Joining me now, Dr. Michael Osterholm, director of the University of Minnesota Center for Infectious Disease Research and Policy, and a COVID task force advisor to the incoming Biden administration. Dr. Osterholm, great to see you. Thanks so much for being with us.
Thank you.
Let's talk about vaccines because the demand here in the U.S. is going to far outpace availability. And so we know sort of generally the guidelines that have been recommended. I guess it's up to the states whether they follow based on their needs. But how do you make these decisions? And how should Joe Biden be making the decisions between healthcare workers, frontline workers, people in minority communities that are disproportionately affected by COVID and underserved, nursing home residents, nursing home staff, other elderly people? You know, who gets it first?
Well, thank you, Andrea. Let me just say at the outset that we have two simultaneous events happening. One is there are going to be those early adopters that want the vaccine. They want it now. And frankly, we want to get it to them. Then you're going to have that second group, which are basically the people who are reluctant or hesitant to get the vaccine, which could be a rather sizable number. We're seeing surveys today suggesting as high as 30 to 35% of physicians, nurses, people in the most impacted communities, the BIPOC community, that basically are not willing to take the vaccine out of concerns. So I think we have to simultaneously work on making sure we get the vaccine to those people who are most likely to have serious outcomes or who are our frontline healthcare workers, and that's the recommendations we have now. Once we get beyond that, I think it's not just offering the vaccine, but we need a major effort that has not happened yet to educate the community, to tell the story of how these vaccines came about, why they're safe, why they're effective. And that's a job that if we don't do, I'm afraid we're going to be sitting here one day with vaccine that nobody's going to want to take.
And with the Pfizer vaccine, it's so perishable after, I think it only lasts for 5 days after you open it. There has to be a second shot in 21 days. Of course, the sub-freezing storage. How does that work? And also, you don't have enough for all the healthcare workers, even if you started with that cohort.
Well, we do have a real challenge right now delivering these vaccines. They are, at best, complicated, particularly the Pfizer vaccine, as you mentioned. And that was what I call the last mile of the vaccine story, meaning that we've done this incredible work to get the vaccines to where they're at now. But how do we get them to state and local health departments, to healthcare providers, and how that's going to work? And contrary to popular belief, that system is not nearly as well ready as people like to think. I like to take it one step further and say we also have the 1 inch challenge. That last inch is going to be critical. Does that needle go into someone's arm or not? And so at this point, we need a comprehensive plan. State and local health departments have not had the resources from the federal government to plan for this in a way that lets them carry out what they need to do. We still have lots of questions about how this will happen. I worry that we will have successfully brought forward effective and safe vaccines, and at best, we're only going to have some use of them. So again, I come back to the fact that I think, yes, you're right. Early on, we're going to have more people who want the vaccine than is available. But in the end, the real impact on our society is going to be getting those 45 to 50% of the population that are hesitant to take the vaccine ready to take it. And right now, they're not.
Well, the UK is going to begin administering the Pfizer vaccine this week, some tomorrow. And the Queen Elizabeth, could be one of the first, and Prince Philip, who's 99 years old. Here we see the Queen last week meeting virtually. She was accepting the credentials from incoming ambassadors and doing it in a Zoom, which shows how she's adjusted to the times. But it might not be so much privilege, but a good modeling to have her and her 99-year-old husband, she's 94, be among the first to take the vaccine to show how safe it is.
I agree, and I think the fact that the former U.S. presidents and the incoming president have also indicated that they, too, would take the vaccine in a very public show of support is really important. Now we need other leaders to step up from the impacted communities, from the Black, Indigenous, and communities of color, from those who are our elected officials, from those who are our medical leaders. These are the people now. We need to have them stand up. And with the appropriate information, they deserve to have all the safety and efficacy data that exists, and then have them model this. I can't wait to get my vaccine. I'm not going to jump in line ahead of anyone who has a higher need than I do in terms of what they do for work or their risk of serious disease. But I can't wait for me and my family to get these vaccines. This will make such a difference in our everyday lives.
Dr. Michael Osterholm, as always, thank you so much for being with us today.
Thank you,
Really
Andrew.
appreciate it.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.